It was a gradual plan, but the plan had been to move into the pharmaceutical industry.
And we're trying to help physicians if they want to do a similar thing. What was your plan to do that gradually?
Do you mean how did I come about doing that?
Yeah, you said, I want to get to pharma, so gee, how am I going to go about doing this? Am I going to start talking to people in pharma to get their advice, or?
Yeah, actually, that's exactly what I did. I had a very interesting situation occur, and that is I used to put on, arrange a number of international bone marrow transplant meetings in pediatrics. And one of the speakers whom I had invited years before was a colleague of mine, so to speak, a professional colleague. And I went looking for her one day, and it must have been maybe maybe 3 years before I actually made the switch to the pharmaceutical industry. I wanted to ask her a question, and found out that she had quit her job in an academic institution and gone to work for a pharmaceutical company. And lo and behold, the pharmaceutical company for which she worked was located directly across the street from the hospital that I was working at. So we arranged to meet, and I ended up hiring her to work part-time for me during when I was at medical meetings or had to be away, because none of the other people with whom I was working were as senior as I was, and therefore did not have the experience, and she did. So I paid her a hefty sum every day that she would cover for me, and she loved doing it. She had let her medical licenses lapse, so we were able to get them back for her and get her privileges at the hospital. And it was actually her influence that guided me into the pharmaceutical industry, because she had already made that leap. Now, she had made the leap for other reasons, and that was that the academic institution that she was at was actually closing the program that she had headed. So she had no choice. I mean, she had to do something different, and so she was forced to, she was at the edge of the cliff, and she was forced to make a leap into something else and decided to quit academia. But the question, as you posed it a minute or two ago, was such that it was very clear that most of my guidance came from talking to a colleague who was already in the pharmaceutical industry.
You had a mentor.
And so, yes, and so that is very helpful to do.
Okay. And did you end up